Hello, good morning, teacher. My name is David Menéndez Isurieta. My topic is renal complication of hematopoietic cell transplantations. Okay, my information. Introduction. Okay, hematopoietic cell transplantation or HCT is the IV infusion of hematopoietic progenitor cells designed to stabilize marrow and the immune functions in patients with a variety of activated and inherited malignant and non-malignant disorders. This procedure may involve either a myeloablative or reduced intensity conditioning regimen, the use of alternative allogenic donors, cells from bone, marrow, cord blood, or peripheral blood stem cells, and new immunomodulatory agents to prevent graft-versus-host disease (GVHD). Indications: these include hematologic malignancy, non-malignant, acute bone marrow disorders, and genetic diseases associated with abnormal hematopoietic functions and severe combined immuno. The next video. Okay, the next slide. Acute kidney injury or AKI is a sudden episode of kidney failure of kidney damage that happens within a few hours or a few days. The next video.
Acute kidney injury, AKI, is a syndrome that results in a sudden decrease in kidney function or kidney damage. Acute kidney injury occurs in about 20% of hospitalized patients and in up to 40% of patients in the intensive care unit. Severely ill patients who suffer from acute kidney injury can have a death rate up to 15%. Acute kidney injury can lead to adverse events such as the development of chronic kidney disease or kidney failure requiring permanent dialysis. It may also increase your risk of heart disease or death. Let me walk you through this population plot figure to overview some of the consequences of acute kidney injury. Let's simulate we have 100 severe acute kidney injury survivors. Let's suppose 10 patients were discharged from dialysis. Of these 10 patients, 4 died. 2 recovered kidney function. And 4 developed chronic kidney disease or remain dialysis dependent. Now let's focus on the group that suffer from acute kidney injury without the need for dialysis, in this case 90 patients. About 1/3 died. 1/3 recovered kidney function. And also 1/3 developed chronic kidney disease or remain dialysis dependent. As you can see, adverse events such as death, chronic kidney disease, or dialysis are not uncommon in patients who suffer from acute kidney injury. What can you do after having acute kidney injury? Number 1, follow up.
Okay, the next slide. Chronic kidney disease, or also called chronic kidney failure, describes the gradual loss of kidney functions. Chronic kidney disease is defined according to serum creatinine levels or estimate measurements of the glomerular filtration rate, or JFR. Okay. Application in medicine. Each year, approximately 5,000 patients worldwide undergo hematopoietic cell transplantations, despite the overall improvement in outcomes after hematopoietic cell transplantations. Kidney injury remains a frequent complication and contributes to the morbidity and mortality associated with the procedure. The onset of acute kidney injury and chronic kidney disease, which affect from 10 or 17% of transplant recipients, varies from days after transplantation to months or years afterward. Acute injury is generally indicated by elevated levels of serum creatinine up to 100 days after transplantation, and chronic injury by elevated levels at or after 100 days. Acute kidney injury that persists for 3 months or longer is usually reclassified as chronic kidney disease. Okay, next video.
When we talk about stem cell transplant, what we're typically referring to is transplantation of the bone marrow. The bone marrow is an organ, just like your heart or your skin is an organ. The bone marrow is the organ that produces the blood, and the blood then circulates throughout the body. When a disease like leukemia hits a child, it resides in the bone marrow. And so in order to cure that disease, we have to give the child very, very high doses of chemotherapy and radiation to kill and eradicate all those cancer cells. And then we rescue the patient with healthy bone marrow from a sibling, or in some instances, from a random donor from the general population. This is the process of bone marrow transplantation, and it involves the therapeutic transfer of healthy blood stem cells from the donor to replace the diseased blood stem cells of the child.
Okay, the next slide. Pros and cons. Pros. Hematopoietic cell transplantation is used to treat a variety of malignant and non-malignant diseases. Cons leads to AKE and chronic kidney disease in 10 or 7% of transplant recipients. Use applied in Ecuador. Hematopoietic cell transplantations are only done in a few hospitals in Ecuador. There are no articles available about the procedure and its complications in Ecuador. Next video.
Fueron una gran revolución médica, la solución para muchas enfermedades incurables en España de los 80.
Se pueden tratar leucemias, linfomas, mielomas, también enfermedades tipo inmunodeficiencias.
Al principio, los trasplantes hematopoyéticos suponían la extracción de médula ósea mediante punciones.
Daba miedo y puede ser doloroso y algo traumático. Bueno, era algo realizable, pero bueno, tenía algunas dificultades.
Ahora, en el 70% de los casos, basta con la sangre. Sangre que se ha enriquecido en células madre o progenitoras y que se aprovecha mediante estos equipos.
Ponemos a un paciente en esta máquina de aféresis, empieza a circular la sangre que nosotros hemos hecho más rica en estos progenitores y podemos recoger solo esos progenitores.
Hay dos tipos de trasplante hematopoyético. El autólogo se realiza con células del propio paciente que se guardan antes de recibir una quimioterapia intensa.
Con eso podemos utilizar un tratamiento muy agresivo y luego recuperar la médula ósea.
En el trasplante halogénico entran las células de otra persona. Para ser donante compatible, tiene que coincidir al menos en la mitad de sus genes.
El donante haploidéntico lo que permite es ampliar mucho las potencialidades de ser donante, porque puede ser tanto un hermano, como puede ser un progenitor o incluso un hijo.
El donante puede ser también una persona sin relación familiar que aparezca en el registro internacional.
Okay. The next slide. Conclusions. Current evidence suggests a need to reduce the cost of acute and chronic kidney injury in patients after hematopoietic cell transplantation. Most such kidney injury is not related to total body irradiation or treatment with calcineurin inhibitors. At the same time that physicians who perform transplantation have worked to decrease toxicity and complications after the procedure by administering agents other than anthracene, adjusting coordination regimens to prevent the hepatic sinusoidal obstruction syndrome and implementing prophylactic regimens against viral infections, acute and chronic. JVHD has emerged as a major cause of kidney injury after transplantation. However, it is difficult to separate out the contributions of calcineurin inhibitors from those of GVHD to post-transplantation renal injury. Thank you very much.